Thank you, Alyssa.
Thanks,
Hello,
Alyssa.
everyone. I'm Charlie Merrill. I'm a physical therapist based in Boulder, Colorado. I've been practicing as a manual therapist for over 20 years, which means the traditional PT modalities you might be used to, like manipulation and needling and corrective exercise and fascial release. And of course, now as a clinical consultant for Lin Health, maybe in the last decade, I've shifted my practice much more in what I'd say is a mind-body direction, where I'm integrating more psychological and socially oriented strategies into helping people unlearn their pain and other symptoms. I'm also an athlete myself, and so some of the questions we'll be addressing today will bounce between different topics. So happy to weigh in on anything you have questions about. That's why we're here.
My name is Jordan Kelley. I'm a physical therapist. Haven't been practicing nearly as long as Charlie has, but I have been going for about 4 years now, mostly hospital-based systems. So sort of see it as the wealth of experience, and then somebody who has this sort of hyper-concentrated experience within hospital systems, a little manual therapy, a lot of chronic pain education very quickly. Charlie has been a mentor to me in the course of that education, just trying to bring myself up to speed as quickly as I can to where pain science is currently today.
I think we mentor each other, honestly. I mean, you dove right into this really early, and I think like that, there's a lot of value in that beginner's mindset that I think is also actually really valuable with people in pain as they're just starting to learn this. Sometimes there's value in that sort of new way of thinking. But
yeah. I appreciate that. Yeah. Try to keep it fresh and novel as much as I can. I'd say, areas that I've concentrated in the PT world, done some manual therapy, a lot of exercise-based therapy, a lot of chronic pain focus. I now use a largely brain-first approach, but offering movement science and sort of some graded sensory motor training ideas around trying to retrain the nervous system around pain signaling.
It's probably important to say, like, one of the things we do as physical therapists is to try to synthesize the mind and the body, because they're connected, they're not separate. And so rather than make it a dualistic idea where we're either talking about one or the other, we like to sort of bring them together as best we can. So hopefully that will be reflected in our questions today. And before we dive into questions, I just want to say a couple things. We're here today to share big ideas and to support you all in possibly starting to think about your symptoms in a new way. Because all pain is a result of the brain, all pain has potential to change regardless of the cause. So you might have a structural problem, or you might have had a structural problem or surgery, or you might have pain that's not due to your body at all. But that said, most symptoms can be completely unlearned because they're not caused by medical problems, damage, age, issues in your tissues, as many of you have been told. And we know the list of diagnoses that are mostly driven by the brain exclusively in the absence of a body problem is really long and growing. Things like fibromyalgia, pelvic pain, back pain, migraines and headaches, and even arthritis. Most members come to us with these really personal stories and struggles, and we won't be able to dive into doing diagnostic work today and problem solving individual cases, but that's why we created Lin Health. And our mission is to make getting your specific questions answered, accessible and affordable. So maybe it's good to start by saying that pain and other symptoms correlate with fear rather than any other factors clinicians have likely attributed to your body or your pain in the past. So just keep that in mind as Jordan and I address your excellent questions. Anything else you want to say before we dive in?
No, I think you said it all. That we'll keep circling back to some of these concepts of fear learning and pain as a signal and connected to the brain. And it's never in an effort to try to discourage how the body can be involved, but more based on the science of the last 20 years, which the medical world is only starting to really catch up to, trying to take a very informed neuroscience perspective to how our bodies really operate and function and give us our perception of the physical world.
Yeah, it's probably important to call out, there's a risk of when you're looking through this brain-oriented lens, there's a risk of minimizing and validating people's experience, because people will hear that it's all in their head. And as I said before, all pain is produced by the brain. The brain is in charge of all pain regardless of the cause. So that's not the message we want to send to you today necessarily. And hopefully that's not how we'll come across. But why don't we dive in? And the first question comes from someone who says, my pain appears in my left buttock and maybe either sciatica or my piriformis muscle or both. So the question is, how do I exercise to stretch those things and possibly eliminate the pain? So this is something I work with a lot in the clinic. I'll start by saying sciatica is a very broad term. It doesn't tell you what's causing those physical sensations in that part of the body. Piriformis muscle is one option. Something going on in the back is another option. And of course, something going on in the brain around life stress is another option. And sometimes it's a combination of those things. Many people go right to stretching because as a society, that's what we sort of, knee-jerk react to. Maybe if I stretch it, it will feel better. And there is a way to stretch the piriformis muscle. There is a way to mobilize the sciatic nerve itself because it's a living tissue. And as physical therapists, we sometimes advise people to do that. But we find that for many people that ends up really frustrating them because it doesn't tend to solve the problem. So where Jordan and I, and where we start with Lin is, let's get a sense for why you're having these physical sensations. Let's try to get a sense for how they started, what might have triggered them, how the symptoms are behaving. And we might learn that the solution has nothing to do with stretching, or it might be more to do with strengthening, or it might be more to do with reducing stress in your life. And there's something that, for lack of a better word, is a pain in your ass that's going on in your life. And we want to address that. And pain is interesting because it can be metaphorical a lot of the time. So I would encourage you, there are tons of videos on YouTube of how to stretch your piriformis and how to mobilize your sciatic nerve. If you want to start there, great, go for it. And if you don't get the results you're looking for, then let's have a conversation about it. Anything else you want to add to that?
I think this brings up kind of an interesting concept in PT that, at least in my formal education, got convoluted, which is this idea of what stretching exercise are good for in the body and what pain relief really comes from. And there's this idea that if I just stretch this muscle enough, or if I just strengthen this muscle enough, that's going to be what gets my pain to go away. And that's not to detract from people who have had pain relief through a regular physical therapy experience of, classic strengthening, stretching, manual therapy. But what we know about pain science is that typically for folks who have had chronic pain going on, it really has less to do with an actual structure in the body that is causing that, and more how the brain and nervous system, as connected to every structure in the body, are perceiving that body part to be in threat. So this is kind of going down a little bit of a rabbit hole, so I'll try to circle back to the main question, which is that there's so many purposes for exercise and stretching, making your body feel good on a regular basis, improving your range of motion,
Showing your brain that you're safe.
Performance, athletic performance. But pain relief, I think it's worth being very intentional about why you're doing the exercise.
Yeah, good point. All right, let's jump on to question number 2. You want to read this one?
Sure, yeah. So it's a 2-part question. 1, after an extensive multimodal treatment plan that included PT and GMI for neuropathic pain.
GMI is graded motor imagery. By the way, for this question might get a little nerdy. We might get a little nerdy, but graded motor imagery is sort of using visualization and more those types of strategies to help people feel comfortable, confident moving again. It's another way to sort of get the brain ready for movements that might have been triggering in the past. So this person had physical therapy combined with graded motor imagery for neuropathic pain, which is, again, we don't have the person in front of us, so we can't tell. Theoretically, there are 3 types of pain. There's secondary pain, which is pain that's due to injury to the body, where there's information coming up from the body to the brain that triggers the brain into this danger alarm state. Then there's neuropathic pain, which is pain that's due to some type of disease state in the nervous system, like something that might be caused by diabetes, or there's a lesion on the nerve itself. And then there's this more primary pain, which is pain that's more exclusively driven by the brain in the absence of a soft tissue problem. That's why we call that primary pain. So let's assume this is more either that sort of neuropathic middle version, where there might be a disease state in the nervous system, or I guess we don't know. So maybe we should just leave that out.
Yeah,
Sorry.
No. So hit a plateau using PT and GMI. Is there anything I can do to further reduce my pain and improve functioning? Second part of the question, is full restoration even possible? Thank you. So my first impulse with this kind of question is, you've tried PT, you've tried some physical approaches, you've tried GMI, which is graded motor imagery. It is actually based in pain science, developed by pain scientists. And it's meant to actually address a bit of that brain-body connection and how the brain is evaluating that part of the body as being in threat or safe.
Like the fear, like addressing the fear.
Exactly.
Of course.
Yeah. So you've addressed fear, you've addressed the structural component. My questions would be starting to explore a little bit more of like, okay, the GMI, were you going through kind of a classic protocol there? How much time did you spend with it? Some folks will go through just a little bit of it.
So let's say they did all that and they did a really great job and the therapist was really good. So then what? Like that didn't work, right?
Yeah.
And we see this a lot. People come in and they've tried 10 different things and with a lot of really good clinicians and they didn't work. And for me, if you step back and take like a meta level view at this situation, it reinforces this idea that the more we focus on the body, sometimes the less far we get. And this begs for a different approach, right? So then what?
So then what? We can start to look at the other factors that influence pain and level of fear and threat in the system more globally. And so we can think about emotional processing. We can think about stress in a person's life, anxiety, and how those can contribute to a greater sense of threat in the whole system. We can also think about the beliefs that are underlying the beliefs and the thoughts that are underlying that pain of, if you believe you can't get better, which often is a belief that's reinforced by the medical system, a doctor telling you, wow, I've never seen a problem this bad before, which we hear all the time, unfortunately, then it sort of puts a ceiling on what your brain believes your body can recover to.
Yeah, and it's important to say these things can be done together, PT, GMI, they can be done together with these more like brain-oriented strategies. So is full restoration possible? If this is truly a neuropathic pain condition, let's say it's caused by diabetes, first you want to address whatever's causing that neuropathic condition. If it's a diabetic situation, then you want to work on that with your physician and do your best to improve the metabolic health of the system. But absolutely, as I said before, regardless of the cause, any pain condition is modifiable, modulatable with some of the things that we're talking about. And oftentimes we see a full resolution of symptoms, but not always, depending on what's going on. So yeah. All right. Question number 3.
Let's do it.
You're up, buddy.
All right. Should I exercise, PT, home exercise, or other kinds of exercise on days when I'm flared up or my pain level is high? So depends a little bit, but I'd say the most cookie cutter answer I can give is avoiding exercise entirely usually isn't the answer. So my first question is, can we modify anything you're doing? For a lot of folks, especially athletes, it feels like anything short of a version of what they used to be able to do prior to having this pain come on feels inadequate or feels like it's not doing anything. And so there can be almost an avoidance on that side of things.
Yeah. Sometimes it can create more fear if you have to stop completely, right?
Right.
Like, so I appreciate what you said, like, let's find a way to like bring the intensity down, maybe find a different exercise to do if that one's too triggering. I often recommend people choose things that are in nature or that are social or that are more joyful rather than like loaded with expectations. Changing the context can make a really big difference when it comes to exercise. But when you're flared up and your pain level's high, it's probably not the best time to push yourself, because remember, pain is sort of a danger alarm system, and it doesn't mean that you're going to damage or hurt anything, but we want to respect the fact that if your nervous system is up here, we want to do things to try to bring it down back to a more regulated state where you can then work with it, whether it's with exercise or with these more brain-oriented strategies like somatic tracking, for instance, where you watch your symptoms with curiosity, without judgment, without trying to change them. This is one of the strategies we teach our members at Lin. and you can even combine that with exercise. But when you're triggered is probably not the best time to be doing that work. It's probably a better time to think about self-care, doing things that calm, like breathe, and try to regulate your nervous system down out of the danger alarm so that you can get back to it. And this is something we do with our members a lot, even with strategies like distraction, not ignoring, but like distraction. Finding other things that take your attention so that it's not so focused on the discomfort.
Right. And just one other point to that kind of like context idea and how the setting in which you approach that exercise or the intention with which you approach it can be changed in the moment. So maybe you're modifying, maybe you're just approaching it as, okay, what can I do with my body today just to get it moving in some way? Sort of an exploration kind of approach, a little bit of curiosity of, okay, how can I move my body in a way that maybe feels, if not perfect, okay,
Yeah. Cool. This is an interesting question from a person with chronic low back pain due to what they said, or what I interpreted, sounds like a severe stenosis. This is like where the spine has had some degenerative change, things have narrowed. Stenosis means that things have narrowed, so there's not as much space for the nerves and they're more likely to be sensitive as a result. This person said they're unsure whether there's compression on the spinal cord or the nerve roots, and is this structural, or whether Lin can help. And he used the words, there's a kink in the spinal cord and the bones are crushed around the cord. Now, I'll just start by saying this is stuff we hear that people learn from their physicians or their physical therapists or their radiologists all the time. Whether that's exactly how the doctor says it, it's not always the case, but that's how people hear it. Things are folded back, they're crushed, they're getting destroyed. It's this very scary sort of narrative that people violent that people carry out of the doctor's office. And again, we can't speak to this case specifically because we don't have the radiology report in front of us, but I've seen a lot of people with even severe stenosis go from not being able to walk to the mailbox to living a totally normal life again. So this is absolutely something we can help with. How much we can help, it really depends on the condition. But I'll just tell you that my aunt, who ran a summer camp, a kid's summer camp for a living, had the most intense MRI scan I've ever seen. You almost wouldn't recognize her spine. It was so contorted and twisted back on itself and collapsed on itself. And she had zero pain. She was one of the hardest working women from the time the sun came up to the time the sun went down. She was short, she was kind of scoliotic and crooked and curved, but she just like got after it. And ever since, as a young PT, I saw that, I really remember that image of how intense the spine can look, and yet people can be pain-free.
Yeah. I mean, it's really amazing. It's something that I saw in clinic a lot, where somebody would come in and I just happened to see their spinal, their spinal column and other readings on there when they came in for a different issue. And they could have a form of degenerative disc disease or stenosis at multiple levels and no symptoms from it. Sometimes the symptoms correlate, and that's why anytime we're reading imaging, we're looking for what is the actual clinical presentation. Does it follow along what we call like a dermatomal or myotomal pattern, specific sensation or muscle patterns that are specifically innervated by that nerve? If it does, let's talk about how they might be related to imaging. But most of the time with imaging, it's really to rule out like the most scary of things. Yeah,
I saw, and this sounds scary, but what's funny is I saw a client yesterday who had similar MRI findings with severe arthritis, severe stenosis, compression on the nerves, all the things, one on the left, one on the right, different levels. None of her objective findings when I evaluated her matched up with the MRI scan at all. And so one of the things that the physicians with Lin Health try to do is give people that like next opinion about, let's really take a look at all of this, your whole story, and let's try to give you a sense for, is this lining up and looking like a structural problem, or is it more looking like a brain-driven problem, or maybe it's like a hybrid, right? Somewhere in between. And just coming back to the idea that, in this client's case that I saw yesterday, the symptoms were much more driven by fear than they were by anything that showed up on her MRI scan. And I showed her the data that she's 80 years old And, if you look at the data, 95% of pain-free 80-year-olds have severe stenosis in their spine.
Right. Yeah.
So, so that's, sometimes people are reassured by that, but anyway. So the next question is around EDS. Do you want to take that one? EDS is Ehlers-Danlos syndrome, which at the extreme version of that is marked by severe flexibility in the joints and some other organs that are involved, sometimes vision, cardiac, heart stuff. I like to look at it a continuum because so many people are diagnosed with EDS who are not at the extreme. They just have flexible joints. They've been really good at yoga. They've been dancers their whole lives. And the physician will cue on, wow, you're really flexible. That must be why you have pain. So I'll just kick it off here by saying that we know that a lot of people on the EDS spectrum don't have pain because there's anything wrong with their body. It's just how they're built, right? So there's your setup.
Yeah.
Tee it off.
All right, here we go. So the question is, I have hypermobility, Ehlers-Danlos syndrome, along with chronic neck, back, shoulder, and hip pain. I have a sense my pain is primary, meaning primarily driven and generated by the brain. Over the last 10 years, my physical strength has declined as pain has made exercise more and more difficult. Many people have recommended strengthening the muscles around the joints to help. However, every time I try to do the smallest amount of strengthening, the pain flares to an intolerable level for a week. It feels like I'm going backwards. What can you suggest to help me actually start to get some traction in strengthening my muscles? So places I would start to suggest, and this is not necessarily knowing this person's history, what they've tried so far within the mind-body world especially, but trying to approach exercise as one of many modalities that can help you get to where you want to be. Having a strong body is important no matter what your level of flexibility is. And so starting by addressing some assumptions or some beliefs that maybe providers have enforced in you in the past around what EDS means and whether it actually causes pain. I know multiple people in my own life with EDS who don't have pain. I think there's also some evidence to suggest, scientific literature evidence to suggest that even though pain is a common complaint with folks with EDS, that they're not actually causally related. And so I think it's helpful to kind of take a step back and say, okay, you have a lot of pain when you exercise. What are some things we can get started with that aren't exercise that can start to modulate your pain? Whether it's doing emotion work, whether it is addressing anxiety and other stress factors in your life, whether it is doing something like somatic tracking and kind of a pain reprocessing therapy approach, which can then be translated over towards movement in order to try to take some of the fear and threat out of movement for your brain and body.
Yeah, I have an example of an EDS client who, just as an example, whose mom and really her parents are all up in her business about this diagnosis and wanting to fix it and wanting to support her with it. And they have the best intention, but it's caused so much stress in her life, the things they've asked her to do and pushed her to do to try to fix this, when really maybe the stress of that family dynamic is important to be looking at. And just to come back to the question, like there's no doubt that having a strong body, as you said, is important. If we improve the muscle control around any joint that moves a lot, it's probably going to feel better. There's going to be less information coming from those joints, and we see this affect multiple joints, right? Is less. That information is not making up to the brain anymore, if we can do that. But if you're finding that you're running into a barrier with doing some of that work, I think it's important to go back and start at the beginning from a psychoeducation perspective. What is EDS? What is EDS not? And what are the other factors that might be driving these symptoms? And we see people do super well when they're open to that process. That said, EDS is a sticky diagnosis. You know, we see this a lot. Once you have it, there are a lot of experts that want to, again, try to fix it. And we know that with any type of pain condition, you know, any of the F's are going to tend to reinforce pain, fear, fixing, focusing on, frustration by, freaking out. I can't remember the other two.
Figuring
out, and there's one more, but
Yeah.
Yeah, we want to get rid of as many of those F's as possible. And when it comes to movement, I'm a big fan of adding an F, which is fun. And the more you can make it fun and not like contrived PT exercises, better. One example, if you're talking about the hips, let's say, if you want to get more control around the hip, you can lie on your side and do these boring PT exercises, or you can pick up a hacky sack or get in the pool and swim a little bit and get those muscles activated in those ways.
Totally.
Yeah.
I kind of like throwing on sort of dance classes sometimes, either a video or attending a dance class myself, just because that's a great way to get into your hips. And you can modify if something's feeling painful, but just approaching it from a sense of like play, exploration, fun,
Totally.
Trying not to make it this hyper-clinical, hyper-focused activity that is meant to really address this body-based issue and sometimes make a world of difference for people.
Yeah, I just saw someone ask a question, can we list the F's? If you go to my Instagram handle at Charlie Merrill, I made a post a little while ago about all the F's. You can find it there. Yeah, I love that. The fitness marshal, right? The fitness marshal is like one of the best online dance. He's amazing. And you can scale that. And you know, this is fun. Let's add that F. Cool. Thanks, Jordan. Next question is actually from someone in my hometown. In Boulder, Colorado. If I accept that my posture and overall body tightness is not the cause of my pain, which is actually in and of itself kind of a radical idea, because the narrative that posture and being on the phone, being on the computer, and how we sleep and how our pillow, that's such a like mainstream narrative in society that those things matter when we have so much evidence that they really don't. So I just want to acknowledge that this question is sort of already starting from a point of, okay, that's probably not the cause of my pain, but this person still wants to work on their posture for vanity reasons, for aesthetic reasons. And I can't tell you how many teenagers I've motivated to improve their posture because of how it reflects on how they feel about themselves and how they look into the world.
Yeah.
And I'll say, look, man, if you want a girlfriend, this is one of the things you can do. And I've actually had teenagers come back to me and say that it really worked. So anyway, what's the best way to work on that? There are lots of ways to work on that, right? Getting a personal trainer, joining a CrossFit gym, doing an online training program, going to take a yoga class, starting to dance. So I don't want to give you one way to do that because there isn't one way. I'd encourage you to think about what is it that you want to do to be in your body, to really knowing your body and feel where you are in space, so you can start to build new habits around how you hold yourself. So you can build new patterns around how you move your body and have more awareness around those things. That's probably the most important thing that I would put out there for a piece of advice. And of course, I live in Boulder, so feel free to call me or reach out if you want to talk more about specific ideas. But I'm a big fan of working on posture for just that reason, for the psychological confidence that it brings. And if anything is going to change your pain when it comes to posture, it's going to be the fact that you feel better about yourself, right? The fact that you show up in the world in a more confident way. Anything to add to that?
I just love this, and I've watched it happen for clients I've worked with before, but I love this idea of how posture it's a sum of the forces we've experienced in our life, as well as a reflection on maybe our inner attitudes around ourselves. So when we're kind of closed off like this, oftentimes that reflects an internal state of being a little bit more closed off or reserved. For some men that, or really for anyone, that can be a sensitivity around just presenting themselves as being open to the world. For folks, anyone in the world who has any kind of sensitivity about the aesthetics of their chest or their neck or anything that would really draw them closed.
Yeah. Actually
changing your posture can have an effect on sort of a, back up to the brain of how you see yourself and how you carry yourself in the world.
Totally. Yeah, just to kind of blow this question up before we move on to the next one, I just want to say that there is no bad posture. The best posture is the one that's often changing, or some people say the best posture is the next posture. And so if you're in any posture for too long, it's probably going to be uncomfortable, and your brain's going to say, hey, could you change it up a little bit? Give me something new. And so that's how I relate to posture and position as a physical therapist more.
Yeah.
Yeah. Cool. Want to jump into talking about some fibromyalgia? That's the next topic on the list.
Let's do it. So I was diagnosed with fibromyalgia more than 20 years ago.
You were?
Fortunately not. I was not given that
You're
diagnosis.
talking in their language, I see.
Yes. I will. More than 20 years ago. I still have the classic symptoms of fibromyalgia: tender points in hips, shoulders, legs, etc. Since then, I've also developed arthritis in my knees, and I suspect in my hips, shoulders, and back. Can this approach be helpful for arthritis? So I want to talk a little bit about fibromyalgia, a little bit about arthritis with this one. Glad this is a personal connection for me. Multiple members of my family have fibromyalgia diagnoses. And so I grew up around folks who have been given this kind of classic idea of what fibromyalgia is, which is often kind of used as a catch-all term when there's not a formal rheumatological or structural process in the body really explaining the disease or the pain, excuse me. And it can often just represent not just feeling bad in your body, but feeling kind of rough and down in your whole life. There's this whole aura that often comes around with fibromyalgia of generally feeling in pain.
Yeah, you're ill, you're not okay.
Yes.
Right?
Yeah. And it has effects on your mood. It has effects on your level of energy. It really tends to affect one's whole life.
And it becomes an identity, right? It really does.
Yeah.
Because you feel kind of stuck with it.
Yeah. Fibromyalgia is one of the most classic forms of primary pain. And so chronic widespread pain is primary pain. And
it's kind of primary pain by definition, which we didn't know really early on. There was always a mystery of what are trigger points, and there are all these physical findings in the body. And I'll just say, like, those things in the case of fibromyalgia are simply the result of a dysregulated nervous system. Those things are not dangerous or a problem in and of themselves, but this makes the point, like, all pain is real, right? There's no difference between pain that's coming from your brain, like in fibromyalgia, and pain that's due to a broken arm. It's the same pain.
Yeah.
So it has just as big an impact on people's lives.
Absolutely. Absolutely. With fibromyalgia, when I'm working with folks with fibromyalgia, generally I'm starting not specifically with exercise, but ways to tone down and even out the nervous system in terms of, sympathetic input, by which I mean, you have these autonomic or very automatic, subconscious control elements.
It's fight or flight. You're getting really nerdy on it.
I'm getting too
nerdy.
Me. All right.
Fight or flight. Fight or flight, right?
Fight or flight.
Your nervous system's in a state of like fight or flight. That's why your muscles are tight.
Yeah.
Because you're trying to get ready to run away.
That's right. Yeah. Being in a chronic state of fight or flight, the ways that you would prepare to run from a lion, your muscles are going to tense up, your heart's going to beat faster, your breathing's going to get more shallow and ready to bring oxygen to all your muscles. Your hair's going to stand on end, your pupils are going to dilate. You have all of these natural responses, which over a long period of time of experiencing that, basically having the accelerator pushed down for years on end, it's going to produce muscle soreness in all of these areas that isn't particularly connected to anything you're doing physically in your life. It's also going to make you feel really low energy because you're constantly having the accelerator push. So what do we do about that? We start with trying to regulate the nervous system. We try to bring in, various ways to relax the nervous system. We can use vagal nerve exercises. We can use breathing and very slow, simple movement just to try to encourage gentle relaxation. We can use emotional exploration work to find out if there are underlying emotions that aren't getting expressed that could actually free up a lot of internal bandwidth.
I'll say one of the things that Lin does really well is sort of addressing what I think of are two buckets of fear. One is addressing your fear around the pain itself and how the symptoms, affect your everyday life and how they've forced you to change your life. And the other bucket is the fear and emotions around other stresses that are going on in your lives, with finances or your family or life change or having to move or COVID or politics. These are things most people would never connect to pain, never connect to their physical symptoms in their body. But we find that if we can work on both of those buckets of fear and emotion, the nervous system really calms. It takes people out of this sort of fight or flight state that we're talking about.
Yeah. We could probably do and I think have done whole seminar on fibromyalgia.
Fibromyalgia, yeah.
Yeah.
And maybe just worth talking about arthritis for a minute, because arthritis, the way we look at arthritis as physical therapists has really changed over time, because we know that arthritic change is normative, which means that it's something that happens to all of us. It's a normal process of aging, like the gray hair that I have, which doesn't hurt, and the wrinkles that I have that I'm getting more of that don't hurt, except for maybe to my ego. The arthritic change that we see in the body does not correlate with pain. I'll just say it really confidently. There's no correlation between the changes we see in the tissue and joints and physical symptoms, except for maybe at the most extreme end of the continuum. So it's not to like say that you know, anyone that has arthritis, everyone that has arthritis should be pain-free. There are certainly exceptions to that rule, but we don't start from that point of assuming that because someone has normal changes in their joint from living an active, healthy life, that they necessarily need to have pain.
Absolutely. Yeah. And even before getting into this mind-body work, I would see just using a classic physical therapy, you know, biology, exercise only paradigm. People recover from arthritis just doing exercise, which at the time I was thinking was, oh, we balanced out the muscle tension around the joint, right?
We're lubricating the joint and we're getting, synovial fluid is going on there.
Yes. What I now see that process as is we effectively used exercise to communicate with the brain and the nervous system that the joint is not actually in danger, that the state of the joint is actually in fairly good shape and doesn't need to have pain.
But it still hurts, and it still even might be swollen, which people have a hard time, because that's a symptom that you can see. It's like, if it's swollen, then it must be damaged. There must be something wrong with it. And that's not usually the case. And we see all of those symptoms change as people start to reduce fear and, again, like address some of the fear and movement avoidance that comes from having pain, and also address some of the other stresses in their lives that tend to play into the brain from the outside that continue to drive those symptoms. So, cool. I think we're going to move on to another question. I'll read it for you. You can start. So I've been a runner for 20 years, since college, and aside from a few ankle sprains and some lost toenails, I've been pretty healthy until this year, when I've been dealing with pain in both my heels for the last 6 months, and I've tried everything with no relief. The question is, does Lin work for athletes or work with athletes? And this is probably like, this person has probably had a diagnosis of plantar fasciitis or some variant of that in both of their feet, and has probably tried physical therapy, stretching, massage, EPAT, seen a podiatrist, gotten orthotics, changed shoes, stopped running, right? Like, I could make a list of 20 things that they probably tried, just to give you a sense. So what do you think?
Yes.
Okay, should we go to the next question?
I can say a little bit more. Yes, absolutely. I think that, you know, there's this idea that primary pain is only a diagnosis for folks who, or that these concepts only work for folks who have chronic widespread pain or pain of 20 years. And, you know, kind of as Charlie was saying up top, regardless of the source of pain, there is utility to approaching pain from this much broader perspective. It sounds like you've done an amazing job of ruling out all of the physical factors around this, which is great, because then it means, okay, here are all the other factors on the other side of the biopsychosocial wheel that are really worth trying and digging into in a really sincere way.
And doing them together, as we said before, like, it doesn't mean that you eliminate doing some of those body-oriented strategies. What's so interesting about this process is that, and just to reinforce what you said, you know, people think that it's just back pain, fibromyalgia, and headaches. No, this applies to all these orthopedic conditions that show up in my clinic: shoulder pain, foot pain, you know, kneecap pain, shoulder blade stuff, you know, I mean, all of these traditionally orthopedic conditions are treatable using these ideas. So absolutely, athletes are welcome, and we encourage them. In fact, I often tell my athletes that there's no better way for the brain to get your attention than with pain. Because if you want to get an athlete's attention, take away the thing they love the most, right? So I just like to normalize this affects, I mean, really it affects all of us. You know, it's a human being condition. It's not like some rare thing. But I'll just say that when we're talking about these things, it's important to start from the place of evaluating the body.
Mhm.
And in this case, trying to give this athlete a sense for, okay, you've done all these things. What do we see now? What's left that's still a body thing that we want to address? Or have you checked that box? And if so, great.
Mhm.
We can leave that behind and we can start looking at some of these other factors and reconceptualizing why the pain is still there. Like, for instance, when you have symptoms bilaterally on both sides, that's a symptom behavior that often tells us that it's the brain doing that. It's not that you have two independent injuries to your plantar fascia. Similarly, if we see symptoms that show up all on one side, the symptoms are all right side, that tells us something. That's a brain and nervous system symptom behavior. It's rare that people have structural problems just on one side of their body. Right? And there's a whole list that we go through with members as we're trying to understand where each person falls on this continuum of a tissue injury to just a dysregulated nervous system. And brain. So yeah, we welcome athletes. We love working with athletes. They tend to be, hardworking, goal-oriented, and they tend to do really well.
Honestly, the only other plug I'd make for athletes and Lin is that I know as my own athletic endeavors in life, just knowing about this work has been so incredibly helpful as almost like preventative medicine. Just because, aches and pains that I might have previously sideline myself for weeks or just push through and made into a bigger issue, I can kind of take a step back, assess all the factors involved between my mind and body, and really have better tools for kind of trying to troubleshoot these aches and pains that just do come up when you have a body and move through the world.
For sure. Yeah, understanding pain is like a superpower. I mean, really for anyone, whether you've had pain for a month or whether you've had pain for 20 years, learning it and understanding how to navigate it really is a superpower. It's a life skill. And this is one of the reasons I get excited to work with kids, is because they're so receptive and they're so quick to pick up these ideas and start to apply them. Kids are amazing that way. Cool. I have a few basic questions here about stopping muscle spasms. Again, this gets back to what's causing the muscle spasm, where is it showing up? And I always need more specifics to sort of give a proper answer. But muscle spasms, are, as we talked about earlier, are often simply the result of a dysregulated nervous system. This is your brain preparing your body to run from some threat, real or perceived. And so I see someone in my clinic twice a month that has a lockdown muscle spasm in their back where they just collapse to the ground. And most of the time, that is not a dangerous back injury. That is simply the nervous system going into danger alarm mode and trying to get that person's attention that something's not okay. So reassurance, ruling out the body, things like deep breathing, gentle movement, addressing the stress that's going on in your life at that time, right? There are a lot of ways to do that. That's one side of the coin. The other side sometimes might be you live in a hot climate, like my dad this time of year in Arizona, and he should probably be drinking more electrolytes when he's playing golf on a hot day, and he might have some muscle cramps or some tight muscles for that reason. So we know that muscle spasm, muscle cramps are a nervous system phenomenon, kind of by definition. And so we want to attend to the nervous system as much as we want to attend to the muscle. Hopefully that does that justice.
I'll add one more quick thing that just probably the thing that got me most on board with a mind-body approach, even working in the PT clinic, was somebody who came in with a muscle spasm, had some findings on his, disc bulging on MRI and the cervical spines. We did a bunch of neck exercises. Neck pain actually improved that way. Wonderful. The muscle spasm still continuing. We hit it with Graston, which is basically scraping the muscle with a big, a metal tool. All of these exercises, contract, relax, not worth getting into everything we tried. But at the end of the day, what actually ended up helping him was starting to discuss like, muscles are attached to the nervous system and they are subject to the kind of feedback loops that fear can give it. So try playing around with and seeing how fear is reinforcing this for you. And his mother kind of reinforced that idea for him of, we'll give him the name Michael, you need to stop worrying about it. And then he showed up and hadn't had a spasm in a week. And this blew my mind and kind of made me want to learn more.
Sometimes it's that simple. You just need to stop worrying about it, Michael. Like, wouldn't that be nice if it was always that easy for everyone? But there is something about that reassurance. you know, done in a compassionate, empathic way that I think is really powerful,
Right.
especially when people can, you know, we often start as clinicians, we often start feeding that to people, but then to be able to do it for yourself is really sort of where we like to get people to go, to make you all self-healers, not dependent on us, not reliant on us. It's not necessarily the goal. Okay, I saw a question about migraines just come up in the chat. I wonder if we have a question about migraines in here, or headaches in general. I don't see one, but maybe it's worth talking about migraines just for a second, because that's another really common diagnosis that we see at Lin, similar to fibromyalgia and EDS and these more common conditions that, you know, like pelvic pain, 95 to 99% of the time are primary pain conditions that are driven by the brain and nervous system, not scary medical problems. And this is hard to believe for a lot of people who have had migraines, because again, there are specialists that want to make this a medical diagnosis. And, you know, medicine works. And some of these strategies like Botox and injections in the neck muscles, some of these things can work in the short term. But pretty universally, what people with migraines find is they don't cure the migraine, right? Right. The headaches tend to stick around until we've added some of these other strategies that we're talking about. So we see in the research, there was just a recent study published that most headaches as a category are primary in nature. Most of these, you know, muscle tension headaches and cluster headaches and migraine headaches have very rare prevalence of medical problems. And so we can sort of start from that place and really start talking about those things in a new way. Again, trusting that people have done the due diligence. Like, people are motivated to try to get over headaches. They've often done a lot of these things, you know, they've done IVs. Like, I have clients who've done IVs to try to make sure they're hydrated. That helps temporarily. People use medicine to try to interrupt the onset of a migraine. You know, that can be really helpful. Even if it just becomes a placebo, and I don't mean that in a bad way, but in a, like, your brain will learn to pair taking of this medication with the interruption of the migraine. And all that is a switch in the brain where the brain says, oh, he or she took the medication, shut down the migraine. So what a cool strategy, right? You and I manipulate the neck, we needle things, we talk about, you know, helping people move better in their lives and be in their bodies and avoid being on their phone like this for 5 hours a day and mix it up, you know? Those things are important to address, but my experience, and how you feel, is that until we've addressed the other factors in someone's life that are causing this danger alarm in the nervous system, the stress with work, the stress with family, the overwhelm of having kids. All of us have been in this state of danger alarm because of COVID and politics and the environment and whatever else. So we're all at this high baseline just as a starting point. And those are the things that we want to do to try to drain the metaphorical bathtub of overwhelm for headaches. Yeah. You want to add to that?
I just add a metaphor, which I will sometimes use with clients. And it's, you know, I think a way of thinking about muscles and body-based structures is the nervous system runs the show with every muscle in your body. So somebody could come in, for example, with tension headaches and have really intense, like really firm paraspinal muscles in the cervical spine. Totally. What is running the show, kind of, you know, like puppet masters to a puppet, is, you know, the nervous system. The nervous system is the puppet master and the muscles are the puppets. The muscles will respond to what changes the puppet master gives to it, you know? So if we're looking to make a long-term change, do we want to be addressing the puppet or the puppet master? I sort of butchered the metaphor, but hopefully you get the idea.
Well done, well done. Gosh, where to go next? I want to just answer this question. Have you seen people overcome knee pain and avoid surgery? And absolutely, the answer is yes. Knee pain, shoulder pain. I've had people that have meniscus tears in their knee, labral tears in their shoulder, labral tears in their hip. Things that show up on MRI that look maybe on the surface like rotator cuff tears, mild rotator cuff tears, like they might be structural problems, and they think they're headed for surgery. And through this process, they absolutely can avoid that. And this is one of my favorite parts of my job, of the work that I do is keeping people out of having to go down that road, because we see so many unnecessary surgeries, so many surgeries that could have been avoided maybe, and I don't like to talk about that too much, because a lot of people have had surgery. In that case, great, like you did the surgery, your body healed, and now let's move on past that, right? But I always like to, if I can, keep people out of surgery. I have a client just this week who's also a friend who was rock climbing, and she was in a funny position and heard a pop in her knee, and she kept climbing and finished her climbing day, and the next day her pain increased. It didn't really swell, but she had some pain and some feelings of instability in her knee. And that's another symptom behavior that we see, is that when the symptoms come on after the incident or on a delay, like you feel okay while you're exercising, but then the next day you hurt really badly, or a couple hours later, these are symptoms that point to more of a primary pain presentation. So I evaluated her knee. Clear there was nothing wrong with her meniscus or ligaments, right? You have to do that body rule out. Like that's the first step in the process. Gave her a lot of reassurance, told her to stay active. She was going to be fine. Talked about some of the things that were going on in her life that week around relationship and around her making a big job change and asking for what she deserved to be paid. And this big negotiation she had was going on for her that week. And within 2 days, she has no pain. Yeah. So we caught it early, right?
Yeah.
And interrupted this sort of danger alarm response that her brain had when she heard this pop in her knee, which was probably just because she was under so much tension and she had a little cavitation, like when you go see a chiropractor. It's probably all it was. But the fear just takes over, right?
Totally.
So,
yeah.
And the more you go down the road of fixing and diagnosing and seeing the doctor and getting radiology and avoiding movement, and and then she's not climbing for 2 months, that fear you can see just continues to grow and take over. And then you have all these confusing and scary stories about what's wrong with your body, when maybe there's nothing wrong with your body from the beginning. Right?
Absolutely. And I think some people are afraid when something happens that if they jump too quickly to a mind-body approach, they're going to miss something horrible and have made a mistake and should have gone to like the traditional or highly interventional medical pathway first. In the vast majority of cases I see, if I had to put a number on it, 99% of cases I see, a mind-body approach would have at least helped, if it was a purely structural problem, help keep their life feeling like it's more in order and help make them feel calm for decision making.
Maybe even their surgical outcome would have been better.
Maybe even,
right?
Yeah, probably even.
Yeah.
And there are really no side effects with a mind-body approach as opposed to surgery, which can have all kinds of complications. It's just important to kind of have that full perspective in mind when thinking about how you want to approach a new pain that comes up.
Yeah, and I think this is what keeps me up at night, right? Is like, what if I miss something? What if I'm, what if there's something that is there? And this is why I have to evaluate people really thoroughly. And this is what we do at Lin, is when people come in, they tell their story and they share what's going on and they share their whole history. They're paired with a physician that can take a look at that and really do the due diligence of a second, third, fifth, 10th opinion to because these physicians are well trained to do this, to really make this determination that we can shift from secondary structural body problem to more brain-driven primary pain. Yeah, and that is a very important part of the process that I'll never minimize. Yeah. You want to pick one of these last questions to wrap up here?
Sure. Let's see. So, how can one treat chronic pain without prescription meds? So I think there's this idea that you either have to use medications and kind of go a full sort of Western medicine route, or mind body and can't use meds at all. You should be trying to get off them as quickly as you can. And I think it's much more helpful to think about it in much more of kind of a graded scale of what helps you get through the day, what gives you some immediate pain relief. Sometimes medication is really helpful for that. And sometimes having a little bit more pain relief from medication actually makes it easier to use mind-body approaches because your whole system feels a little bit less immediately threatened by the pain symptoms. For folks who have co-occurring, mental illness going on as well, sometimes having medication allows the brain to be in a more receptive place to neuroplastic reprogramming, which is a fancy way of saying what we're talking about right now, which is trying to rewire the brain and nervous system around fear and pain.
Yeah, that's a good point. Thanks for sharing that. There's maybe one more question here. I've accepted that I have TMS, which is what John Sarno originally called tension myositis syndrome. It's not a great name because it uses the word syndrome. And as I said before, this is just a human being thing. Like, this happens to all of us. Most people just don't notice. But let's call it primary pain or mind-body syndrome, or whatever you want to call it. The question is, what do I do when I get flare-ups and I'm having trouble to know what to do besides the mantras that I got from Dr. Sarno? And John Sarno, he passed a few years ago, brilliant, created the foundation for a lot of what we're talking about. His strategies like mantra are still used and they're really effective. But I can tell you that Lin Health has expanded massively on the number of strategies that we use to help people calm down flare-ups. And they can be very personal and they're very different for different people. And we see that people like start with a mantra and it helps, and then it loses its power. And then we need to shift to another modality. And this is what the coaches at Lin do so well. And this is, I think, the value of this coaching-based model, is they're able to work with people on a regular basis to adapt real time to whatever's going on. It really is a process. There's not like one magic bullet. I mean, for one person, mantras work great. For someone else, they might need to do somatic tracking. And they might need to, as I said before, watch their symptoms with curiosity, use that strategy. For someone else, it might be making a big change in their lives to reduce stress, or just changing their perspective on that situation and shifting their mindset on that situation can be really big. And this is, again, why the coach is so important, because it's different for every person. So that's why we're here. So we appreciate you all, joining us to hear more about this emerging, hopeful, amazing, powerful new idea around pain and other symptoms. And we just want to remind you that, like, Lin was created to be accessible and affordable, and so you don't have to sort of suffer and be confused and be bounced around in the medical system.
Yeah, absolutely. And we so appreciate all of you joining us today and asking questions and engaging in the chat. We weren't able to be directly involved in the chat, but hopefully you got your questions answered by some of our colleagues who have been messaging back. I think there will be some contact information in there if you have follow-up questions that you want to ask on any of these topics we've covered, or mind-body approaches in general.
Cool. I did see a question about CRPS in the chat, and I just want to address that briefly, because the person said, I know there's not a cure for this, or I know there's not a solution for this now. And you and I have seen many people recover from CRPS. I've seen people that have had it multiple times. And I mean, can you imagine, like, it's one of the most painful, uncomfortable conditions. And it's one of the diagnoses that people talk about it the most hopelessly. Like, there's nothing you can do for it. It's absolutely not true.
Medical professionals.
It's absolutely not true. I'm not going to say it's not challenging, because the pain, it can be so severe, but there has to be this sort of surrendering of belief to the idea that things might be able to change. And those of us that have seen this change are sort of trying to, like, put it out into the world, like, this isn't hopeless. You're going to be okay. There's hope for you. So reach out to us if you want to talk more about CRPS.
Yeah, please.
Yeah. I timed my tea perfectly. It's almost gone.
Oh, well done.
Thank you all for making time to join us today. And we'll put out the recording tomorrow. So if you want to rewatch, or if you want to share with your friends, we'd really appreciate it. Jordan and I are working really hard. This is our passion, our mission in life. It brings so much meaning to our work to get this message out into the world. So anything you can do to support us in sharing these ideas with your family and friends, we'd really appreciate it.
Yeah, 100%.
Anything else?
I think that's it.
All right. Cheers, man.
Cheers.
Thanks all.
Thanks, everybody.
See you next time.